Our next speaker, Alexandra Mays, is the Senior National Program Director at Healthy Schools Campaign. The Healthy Schools Campaign strives to ensure all children have access to healthy school environments where they can learn and thrive. Ms. Mays leads the campaign's work to increase access to school health services through Medicaid reimbursement and works with states and school districts across the country to expand their school Medicaid programs. We're so fortunate to have Ms. Mays with us today to share findings from a learning collaborative working to increase access to mental health services in schools and promote safe and supportive school environments. Alex?
Great. Thank you so much, and thank you to NIHCM for hosting today's webinar on this incredibly important topic. So again, my name is Alex Mays. I'm the Senior National Program Director for Healthy Schools Campaign, and we're a Chicago-based nonprofit, and all of our work really sits at this intersection of health and education, and we work to ensure that all students and staff have the opportunity to learn and work in a healthy school environment. And so what I really want to do today is share lessons that we've learned over the last 4 or so years from our work that we have actually done in partnership with Trust for America's Health. It's wonderful to follow John. And that work is really centered around how we can support states in expanding access to school health services and safe and supportive school environments. And a core component of this work has been looking at how we can expand access to school mental health services. So I want to share some of the lessons learned from that work and lift up some of the great state work that we're seeing take place to move these efforts forward. So the effort that I specifically want to share more about is called the Healthy Students Promising Futures Learning Collaborative. And this was an effort that was launched actually in the summer of 2016 by the U.S. Departments of Health and Human Services and Department of Education. And Healthy Schools Campaign and Trust for America's Health have since taken over leadership and now co-convene the effort. And the Learning Collaborative really focuses around this goal of how we can provide states with opportunities for technical assistance and training and peer-to-peer learning around how they can increase access to Medicaid services in schools and promote safe and supportive school environments. We currently have 15 states that are participating in the Learning Collaborative, and what it means for those states to participate is that they've all formed state teams that include representatives from their state Medicaid agencies, their state education agencies, and then at least 2 local school districts. And many include a number of other partners on these teams, from state public health to advocacy organizations to state stakeholder associations such as State Association of School Nurses and the School-Based Health Centers. But really core to this work is looking at how we can bring together these cross-sector, cross-level partners to move forward this work around expanding access to school health services and safe and supportive school environments. We also have a whole host of national partner organizations that are supporting the work to really also provide technical assistance to those states. And so while the focus of the Learning Collaborative is a little bigger than just mental health, what we have seen over the last couple of years has just been a tremendous amount of increased attention around the need to support school mental health services and safe and supportive school environments, and really an eagerness from states and school districts across the country to identify evidence-based interventions and strategies that they can be implementing to advance this work and meet the needs of students. And I think there are a number of factors that really are driving this increased attention and this demand that we're seeing from states, including a lot of what has been referenced by previous speakers of just this increased recognition of this critical relationship between health and learning, but also an increased understanding of unmet student mental health needs, and the unfortunate reality that so many students are coming into school with unmet mental health needs that impact both their ability to learn and then also their long-term health and wellness. There's also a number of key policy opportunities that really present a chance for states and school districts to move forward this work around supporting mental health and wellness within schools. There's a very specific opportunity within Medicaid, which I'll go into a little more detail about in a moment, but a chance to draw down additional federal resources to advance this work. And then a key shift also has been on the education side. And in 2015, a new education law was passed called the Every Student Succeeds Act, which replaced what we all knew as No Child Left Behind. And really, we see it as representing a paradigm shift in terms of recognizing the importance of supporting health and wellness and the whole child, and really creating a tremendous amount of flexibility for states and school districts in how they go about doing that, including some very specific funding opportunities to support mental health and wellness within school environments. And then in addition, it's been so eloquently framed by previous speakers, the rise in terms of the opioid epidemics and suicide epidemics, as well as very real concerns about school safety, have really been driving a lot of attention around the need to support school mental health services. And so just to level set, when we talk about mental health services in schools, we find that many people come in with kind of a preconceived notion of what that could mean. And really what we see is that by no means is this a one-size-fits-all model, that we often see districts and communities bringing together a variety of models to be delivering mental health services within schools, and in turn, leveraging a number of different funding mechanisms to support that work. So from more traditional models like school-employed providers such as school psychologists and school social workers and school counselors, to mobile vans where you have partnerships, with hospitals and other providers that are actually bringing in mobile vans to do delivery of services, to telehealth, which is where we're actually seeing a lot of momentum building as communities are faced with lack of access to mental health providers and increasingly relying on programs that are driven by telehealth to enable communities to be connecting with providers remotely to do this work. And then another very common model that we see is really partnerships with Medicaid providers and with providers within communities. And so that could be partnerships with school-based health centers that are located on site with schools or nearby and linked to the school and run by federally qualified health centers. Or we increasingly see partnerships with managed care organizations to create unique structures to really think about how we can be funding this work within schools. Partnerships with children's hospitals and really looking at the role that they can play to be supporting delivery of mental health services and programs within schools. But I think across the board, what we really have seen is this tremendous amount of cross-sector collaboration around this work, and not only this recognition from education of the critical importance of supporting mental health and wellness within schools, but also on the healthcare and public health side of the tremendous value that there is in terms of partnering with schools to really meet the mental health and wellness needs of students. And so I wanted to take some time to specifically dig into some of the opportunities and some bright spots as well that we have seen emerge from the Healthy Students Promising Futures Learning Collaborative. And the first one that I want to dig into is specifically around leveraging Medicaid funding to support the delivery of mental health services within schools, which is really an exciting opportunity for states and school districts to be looking at as a mechanism to draw down funding to really support the expansion of mental health services within schools. Medicaid has had a long-standing role of funding health services within schools. But that setup has been limited to a very specific set of services. And specifically, historically, Medicaid has only reimbursed for services that are explicitly included in students' individualized education program or special education services. So those tend to be more services like speech therapy and occupational therapy and physical therapy, and less of your mental health services that we know are being delivered within schools. And so while there has been this long-standing history of Medicaid reimbursing school districts for services that are delivered, it has really been for a limited scope of services. Only about 14% of students across the country have individualized education programs. But fortunately, almost exactly 5 years ago, Centers for Medicare and Medicaid Services actually issued a state Medicaid director's letter, which changed this long-standing policy and explicitly said that Medicaid reimbursement to schools is no longer restricted to those services that are included in a student's individualized education program, which essentially means that now states can make the decision to allow school districts to seek reimbursement for any Medicaid-eligible service delivered to any Medicaid-enrolled kid, which is a tremendous opportunity for supporting the delivery of school mental health services within schools. So any Medicaid-eligible mental health service that is being delivered within the school district, traditionally there have been some very stringent limitations around that, and there's now an opportunity to seek Medicaid reimbursement for those services. The one key point is that states need to make the decision to move forward with this change, and the majority of states need to submit a formal request to Centers for Medicare and Medicaid Services via a state plan amendment change to implement this change. So the state Medicaid plans are intended to be living documents. State plan amendments are submitted regularly. It's by no means an insurmountable barrier, but it is a step that states have to take and means that in most states that decision needs to be made, and this is not an opportunity that is automatically available to districts. So just to highlight where we are since this policy has been changed, there's been 10 states that have moved forward with this opportunity, and then those are in darker green, and then 4 states that have requests pending with Centers for Medicare and Medicaid Services. The majority of these have moved forward with this change within the last year. Again, this increased recognition of the role that schools can play in terms of meeting student mental health needs has been driving a tremendous amount of momentum around states leveraging this opportunity. Michigan is a really nice example of a state that has done this. They passed legislation in 2018 that allocated $31 million in funding to hire mental health providers for the general student population, so students without individualized education programs. And then as a part of that legislation, they required the state to expand their school Medicaid program and leverage this opportunity to enable school districts to seek Medicaid reimbursement for an expanded range of services. And they also really looked at who was delivering mental health services within schools and saw that it was school psychologists and school social workers and school counselors, behavior analysts, and a range of other providers, and determined that those providers couldn't actually bill Medicaid for those services, and so they went ahead and added those providers as well as a part of their change. So we're really excited to see how the expansion within Medicaid unfolds. I also just wanted to take a moment to highlight a couple other states that are in our learning collaborative that I think just are doing a really tremendous job in terms of thinking about how to support the mental health and wellness of students, and specifically with an eye towards delivering mental health services. Colorado is a fantastic example that we point to frequently. This aligns really well with Dr. Ethier's slide of the multi-tiered systems of support. But Colorado is really looking at how they can support a range of mental health services and mental health programs with an eye towards serving all students. And they're also doing that really with an eye towards how they can support districts and leveraging a range of service delivery models. So looking at how they can deliver services through those school employed providers, how they can partner with school-based health centers, how they can partner with community providers to bring in therapists to the school districts where districts aren't able to employ them. So it's just a really tremendous model with a lot of fantastic resources that are available through the state to support this work. They're also doing a really great job of braiding together a number of different funding sources to support this work. And I think that is something that we see across the board, is that there often is not one pot of money necessarily to support this work at the state level and district level. And so we see some really innovative work going on to braid and blend funding streams to do this work. So Colorado is leveraging, they have SAMHSA Project Aware funding, they're leveraging Medicaid funding, and they've submitted a request to expand their program. They're leveraging marijuana tax funding to do this work, as well as a number of other federal and state sources of funding. California also has a really fantastic model that is very much framed around supporting trauma-informed schools and bringing together a lot of key partners to do this work. And so they have a statewide social and emotional learning team that brings together a lot of different sectors to advance this work, as well as an interagency team for children and youth that is strongly focused around supporting trauma-informed schools across the state. And they also are leveraging a number of different funding streams to do this work. And then finally, I just wanted to point to South Carolina, which is just a really fantastic model of a statewide school-based telehealth program, which again is a modality of delivering care that we're increasingly seeing used by communities and states. They have one of the fastest growing networks across the, in the country, and it's currently serving 80 schools across the state. And it delivers a range of services from acute illness care to chronic care management, but then mental health is increasingly becoming a focus of that work. Specifically right now, focused around ADHD management and cognitive behavioral therapy via telehealth, but I know they're also looking at expanding to additional mental health services. And that program is actually run by the Medical University of South Carolina, but then they have close partnerships with their state education agency and state Medicaid agency, as well as advocacy groups and districts across the state. So I just wanted to point to one additional resource that I know states in our learning collaborative, I think, have found incredibly helpful, and for folks who are really interested in getting into some more of the nuts and bolts around funding mechanisms to support this work and best practices and evidence-based interventions. Last summer, SAMHSA and CMS released an informational bulletin, which didn't include any new information or decisions, but really does an incredible job of summarizing best practices and more or less creating a menu of options of how this work can be funded. So it covers some of the models that I've discussed today and speaks to the role that school-employed providers and telehealth and partnerships can play in supporting this work, and then also speaks to a number of different funding mechanisms which are listed here. So I just wanted to call attention to that as a very helpful resource we found. I think, you know, a very clear message from those agencies of the role that schools can play in terms of supporting mental health and substance misuse, and then also providing some very concrete steps to support this work. So just to conclude, I wanted to review some of the key lessons that we've learned from this work in terms of working with the 15 states in our learning collaborative. I think a lot of these themes have been emphasized throughout the presentations, but above all, just the value of cross-sector collaboration in terms of moving this work forward and bringing those partners together early. So often in this work, we'll see initiatives that are driven just by education or just by Medicaid or just by other partners. And I think the ones that are most powerful, such as the work happening in Colorado and in California, and even the telehealth example in South Carolina, have really been grounded in the fact that they've brought together a range of partners very early on and looked at all the parties that can support this work and would potentially be impacted by it. Another key lesson learned is just how critical it is to establish common vocabulary between different agencies and partners when you're doing this work. We often find that education and health and public health and others, you know, end up using very different words when they talk about mental health and wellness, particularly as it applies to schools. So, you know, whether it's in your state, if the schools are talking about this work in terms of conditions for learning or safe and supportive school environments or trauma-informed schools, there's just tremendous value for any sector that's looking at establishing these partnerships in looking at where the strategic priorities are for those partners and thinking about how you can really message this work in terms of how it supports that work. And that certainly goes for also, aligning metrics where different sectors can be supporting one another in terms of advancing key metrics that can support this work. And then finally, just, certainly the power of learning from other states and looking at how we can adapt lessons from other states and communities to advance this work, we've just found to be tremendous in terms of building momentum and really recognizing that there's no one-size-fits-all solution, but that there can be a lot learned from looking at how other communities have really dug in and addressed these incredibly challenging issues and leveraging those lessons learned to advance work within your own state or community. So I will wrap up there. My contact information as well as links to our Learning Collaborative website is available there, and would welcome any questions, or if folks are interested in learning more or connecting about the Learning Collaborative, would be happy to do that. Thank you.